Now, it's something rarely spoken about. In fact, in some areas, it's a downright taboo subject. I'm talking about menstrual health. Now, there are calls for African countries to break the silence and promote awareness about challenges posed by menstruation. The African Coalition is holding a menstrual health symposium to look at menstrual, sexual and reproductive rights and issues. Let's discuss this now with Renata Tallarico from the United Nations Population Fund. Renata, good morning, and thanks so much for your time. It's wonderful, yet it is sad that we actually have to raise issues around menstrual health in the year 2021 and prove to the world or tell the world that this is actually a human right and the needs around this. How is your meeting addressing the various challenges?
Thank you. Thank you very much for having me. And let me start saying Happy Menstrual Hygiene Day to everyone. Today is the 28th of May and we celebrate menstruation. And I think it's very important because menstrual health is normal and is universal. And really, half of the population in the world either is menstruating now or will menstruate or menstruated. So it's very important to normalize it and celebrate it as well. And as you said, it's a little bit unsettling, the fact that as of today, 2021, we're still really battling with the fact that menstrual health sometimes is secrecy, sometimes it's a taboo, and very many women do not have access to the basics, which is menstrual products. So it's very important for us that working with the Africa Coalition on Menstrual Health to really highlight what collectively we can do together to realize menstrual health in the continent.
Well, as you say, Renata, and as we've long known here in South Africa, on the continent as well, we have young girls who are actually missing school. They're missing out on an education. The education is being impacted because they don't have something as basic as sanitary pads to wear that they can actually attend classes. We also have women, whether it's corporate or women who work on the lower rungs as well, who are so debilitated by pain at that time of the month, but they can't take a day off work because who's going to say, I've got period pains, I can't come to work, and it's actually that bad. So where exactly are we making any progress?
I think even before we start talking about progress, let's give the audience a little bit of hard data. 1 in 10 women do not miss school, rather girls miss school due to menstruation. And we also know that in terms of absenteeism, between 10 to 40% miss school or work due to pain or lack of access to menstrual products. But what is really interesting, because menstrual health is not one dimension, it's not just a biological process, but it's also multidimensional, looking at very many aspects and how it influences very many aspects of your life. And one of those is mental health. We know that 14.2% of women that experience period poverty, they may also have severe to moderate cases of depression. So it's very important to realize that and realize the fact that it's not just a puberty issue, is an all ages issue. It's from menarche to menopause, and there are very many other challenges attached to it.
And, when do we come to the point, Renata, where we actually have things like sanitary pads, tampons, those things that are actually free, because they should be declared, it's a basic human right to actually have those as women. It's something that we can't control. So what policies need to come into play here to make that possible? And also, like you say, where we're looking at things like menopause as well, where women find it at some point in their life very difficult to function as they normally would maybe 5-10 years before that. So what policies need to come into play? Who needs to come to the party to actually understand what it is we go through in our lifetime?
Indeed, menstrual health is a multi-sectoral concern, and it is important to have everybody on board. And this is the reason why we came up with the Africa Coalition and why we have every 2 years a symposium that brings together different sectors. The symposium just concluded yesterday really had governments, parliamentarians, civil societies, private sector, really academia, really joining efforts to make sure that we come up with solutions that are sustainable, because that's the whole point. It's not the once-off intervention that changes the situation, but it's rather finding sustainable solutions. And many governments in Africa have already initiated that process, and I think it's important to acknowledge that. Taxation issues addressed, but also many others have not. And we do have very many opportunities to make a difference. But as you said, it's not a one sector concern. It's definitely an effort that requires many sectors to join hands, both public and private.
All right, Renata Tallarico, thank you very much there. And the Africa Coalition Menstrual Health Symposium that has happened this week. Well.